Hello. Okay, I'm
So,
gonna play a couple songs. My name is Sarah Torres. This first one is called With You. It's a song of love and solidarity. Here we sit talking about way things could be. Here we sit wondering why things are the way they are. We don't have all the answers, but I'm glad to take it one day at a time with you. Here we stand, looking straight ahead, heads held high. Here we stand, no backing down, no matter the consequence. We don't have all the answers, but I'm glad to take it one day at a time with you. Here we are in the street, strong in our solidarity. Here we are, walking side by side, strong in our love. We don't have all the answers, but I'm glad I take it one day at a time with you. With you. With you. With you. Oh, thank you. So this next song is called I Hear the Birds Singing. I just wrote it not too long ago. It's a song uh, for people, for us during the COVID-19 crisis. Up late at night, I hear the birds singing. They're choosing to share with us the wisdom we are needing. A song they my dog's sipping water, sorry. A song they are singing for all of us, reminding us of the safety that can be while at home in their nest. If you're able, stay at home, it's really for the best. I know at times it's hard and you might be by yourself, so pick up the phone, write that letter learned from your bookshelf. We will turn through this chapter in the book of life. A good time for learning. Exercise and rest. If you're able, stay at home, it's really for the best. And to you who have to work during this dangerous time, please take care of yourselves and thank you for risking your lives. At the grocery stores and the pharmacies and the hospitals, and making deliveries at the post office, the nursing homes, collecting our trash, you're all working during this unknown, whether by your choice or not. But for us who are the rest, if you're able, stay at home, it's really for the best. If you're able, stay at home, it's really for the best.
Thank you so much.
Yeah, thank you. That was less than 10 minutes, but that's what I got.
Great. Okay, thank you so much. That was a really, really great vibe to start the meeting out with. We're gonna get going here. Thanks everybody for joining us. My name is Jason and I'm with Moratorium Now. And we're gonna be having a few different speakers talking about Cuba here, and we're also gonna talk about our initiative, which is called Allow Emergency Medical Aid from Cuba, which is the sign you see behind me here. Just a little bit about what our group is. We are Moratorium Now. We're a Detroit-based group that began, I don't know exactly, I've been with the group for a little over a year, I think, but maybe about a decade ago, helping people trying to fight evictions in Detroit. And we have been involved in everything going on with the people in Detroit, things related to access to water, access to housing, utilities, incarceration, all sorts of issues, just anything that's sort of going on with the people in Detroit. And now at this point, since COVID-19 broke out, we've always been very focused on Cuba, and we've worked with IFCO Pastors for Peace a lot with the Cuba Caravan. And now, since the outbreak of COVID-19, we've been very aware of Cuba and how they're helping countries all around the world to deal with COVID-19. So we decided to start this campaign, and I'll be talking more about it later, but it's basically reaching out to Cuba and also urging Governor Whitmer and everyone to support the ability for Cuba to come and help us, because we need Cuba's help as well. And their medical system is wonderful, and they're doing a really great job. And we'll be getting into that a lot, but that's sort of where this campaign came from. And yeah, this meeting, also just to say, this meeting is in association with IFCO Pastors for Peace. So we'll be having people speaking about that as well. And I think without further ado, we'll just go ahead and introduce our first speaker, which is Lisa Volante of the Cuba Caravan. So Lisa, do you want to go ahead?
Yes, thank you. My name is Lisa Volante. I'm coming to you from Pittsburgh, and we have a Pittsburgh Matanzas Cuba Sister City partnership, and we've been following events going on in Detroit. So I just want to, on behalf of my organization and my city, say that the struggles that are going on in Detroit now are something that we definitely hold in our hearts, and the solidarity that we feel and the work that we're doing is hopefully complementary with yours. And thank you so much for having me tonight. I'm 72 years old, and I started out as an aspiring activist in the United States. I was born in New Jersey and grew up in Cincinnati. So I have been socialized to be an American under capitalism. However, my generation, we had to fight the Vietnam War, and that was a wake-up call for me. I was a pacifist, and in 1971, I had my first opportunity to go to Cuba with a group called the Venceremos Brigade, which I thought was a Habitat for Humanity. When I went to Cuba in 1971, it was against the law to go to Cuba, as it has been for many, many years. So I was really only going because I wanted to support my constitutional freedom of travel. And I had no idea about Cuba or any of its history, or that it even had a revolution. In fact, when I went to Cuba, which was only 13 years after the revolution, people were running around the streets with guns. And I said to them, "Didn't you ever hear about Martin Luther King?" And they said to me, "Didn't you ever hear about the Bay of Pigs?" And of course, I didn't know anything about the Bay of Pigs. I didn't know about their revolution. I'm telling you this story because I want to say that we're all on a learning curve. And I want to talk a little bit about the learning curve that has been part of my life, because I think it's important to a lot of people that haven't been exposed to progressive ideas and have been brought up to think there's nothing they can do. So when I went to Cuba, I hated Cuba. To begin with, first of all, they all spoke Spanish and I didn't have a clue as to what they were saying. Secondly, they had this revolution and they were an agrarian society. And I came from middle class, upper white, privileged society. So I found that having to use a trench to go to the bathroom in, and in eating rice and beans, it just wasn't anything that resonated with my experience in life up until that point. When I went back from Cuba, I was approached by the House of Un-American Activities, as were everyone that went to Cuba that year, and we were brought up before the House of HUAC, Un-American Activities. And although we never appeared in front of a grand jury, it was quite radicalizing to end up to find myself an international subversive for having only gone to Cuba. But I spent the rest of many, many, many years after that being a union organizer and trying to do work in this country. It wasn't until about 1991, after the Iraq War, that I went with a group called Pastors for Peace, IFCO, to Central America, where I met Reverend Lucius Walker and his daughter Gail at the time. And it wasn't until I had been in Central America and seen Honduras and Guatemala and El Salvador that I understood what Cuba was and the importance of its revolution. Because I had been comparing Cuba to my life in the United States. I wasn't comparing Cuba to the Central America and Latin America and the countries which were struggling with all of the things that Cuba had been struggling with: colonialism, imperialism, and all of these things. When I went to Central America in whatever year that was, I can't remember, 91, 92, something like that, again, seeing death squads and seeing the situation in Central America, which, by the way, Pastors for Peace was very active in. At that time, the word solidarity, they certainly taught me a lot about that, because they had been down there bringing humanitarian aid to people caught in the crossfire of the Central American wars. The next year, Pastors for Peace started the first US-Cuba Friendshipment Caravan, and they were the first organization in the United States to ever physically take humanitarian aid to the people of Cuba. And that was taking powdered milk to Cuba. At the time, one couldn't even do that. The churches couldn't do that. And almost all of the things that we take for granted today, in what little legality there is, travel to Cuba, the things that can be traded to Cuba or taken to Cuba or donated to Cuba, were all things that Pastors for Peace, in its many years of caravans, they opened the doors. Each year they would take something that was forbidden, and the next year it wouldn't be forbidden. Then they'd take something that the next year that was forbidden, and there would be a big struggle around it, and the next year it wouldn't be forbidden. So all of these gains that we have been a long, long process, at least in my life, over 20 or 30 years. And I believe that IFCO Pastors for Peace is an organization that I have to thank for my transition from hating Cuba to coming to understand Cuba in its true context, and also for my own devotion then and service to the causes of, as Jose Marti said, humanity is our homeland, for becoming a global international citizen. I'd like to tell you one story briefly about in 1971, we climbed Torquino Peak, which was the highest peak in Cuba. And it was where the revolution, many of the people had hidden and the revolution had developed. And it was an all-day climb. And when we got to the top of it, there was a cabin up there that didn't have water, didn't have electricity, had no amenities that anyone could, that I could think was important. And there was an old man there. And I said to him quite sarcastically, well, I guess the revolution didn't do very much for you. And he looked at me kind of shocked, and he said, oh no, the revolution did something very important for me. And he called in his grandson, and he sat his grandson down. They had an old wooden rocker there, and he sat the grandson down, and he opened up a book, and he started to read to his grandson. And what he said to me is, what the revolution gave me is the ability, the dignity, the ability to communicate, literacy. And he considered that the most important thing. I say that because as we begin to look at our own country and choices we have to make and things we have to, in that battle of ideas, the battles we have to win, we need a very broad toolbox. And one of those things is the ability of literacy, of people to be able to participate in dialogues and discussions for their own betterment, to be stakeholders. You know, when I had a conversation with Fidel one time, and he said basically that for him, the most important battle he'd ever won was the battle of ideas, that if you can't build a democracy, if you can't win enough people over to support your viewpoints, your ideals, your desires. So the literacy campaign in Cuba, when they started, here comes Fidel, this is my cat. When I was there 13 years after the revolution had succeeded. But now the revolutionaries had to deliver on their promises. They had to build a society from the world up. They had to provide services, and they had to have they had to have the participation and support of people. And how did they get it? One of the things they couldn't do is, if people couldn't read, how could they know what ideas were being conveyed? How could they participate? So they started a literacy campaign called Each One Teach One. And what that did is, if you had whatever level of education you had, you taught the person underneath you that had less. So every single person was a student, and every single person was a teacher. And this campaign, within a year, helped eradicate illiteracy and made it possible for people to communicate so that they could build civic society, they're what they called committees for the defense of the revolution, that those community groups could then have a way of making proposals and taking over governance and self-governance. And that's a really critical thing. I mean, the Oxford English Dictionary says that, sorry, my cat wants my attention. The Oxford English Dictionary says that revolution is the highest form of democracy that exists, because it is a time when masses of people come together and agree that something has to change, and they work together to make that happen. So again, I think, you know, issues like what is solidarity, what you have to stop. Sorry, I used my time to get distracted by this. Anyway, I just want to say that we're all on a learning curve. I'm on a learning curve. I'm still learning. I'm very much looking forward to what I'm going to learn tonight as we share experiences, but also as this country and the entire global world has to deal with COVID. We're going to have to, everything is going to be upside down. All the institutions, all our ways of protesting, everything is going to have to be new. How vulnerable are we as on Zoom in holding on to our communities? Who actually owns this technology? How do we create ways that we can come together and be stakeholders in our future and the future of this country and this world? So I'm going to stop there. There were a lot of different things I wanted to say, I'm sure, but I want to just say how important it is to take ownership of being a revolutionary, an aspiring revolutionary, and how lucky we are in the United States to have a revolution like Cuba that actually embodies the type of ideals that most of us want to aspire to, whether it's healthcare, whether it's education, that we have a living example of people who have made those sacrifices. And we're not going to have to copy them, but we can learn from them, we can share from them, and we can be in solidarity with them. Thank you.
All right, thank you, Lisa, for that presentation. Next up, we are going to have Maureen Taylor. Maureen is a Michigan Welfare Rights Organization state chair and a member of Michigan Coronavirus Task Force on Racial Disparities. So, Maureen, if you want to go ahead and get started. Thank you. And let's see, you're still on mute. There you go.
Not now. Okay. That was a very wonderful piece of information that Miss Lisa just gave, and you know, clearly recognizing her involvement in as a student of change, as a student of revolution, and one can see and can hear immediately that she has an interest in those roads to freedom. For whatever reason, I was asked to join this task force that's around racial disparities. And that is in connection with the fact that so many people of color find themselves on the infected list and or the dead list in terms of the numbers and the data of the after effects of this virus across the country. And it's a sad and a, what's the word? It's a terrorist kind of activity that a lot of us live in, because so many folks are aware that as women of color, oftentimes we are hunted. And it just never occurred to me that there would one day be a virus that I would have to run from as well. Just never thought of that. So we've got, I wrote the numbers down, we've got almost 45,000 infected people in Michigan, more than 4,200 already have died in just this state. The numbers of African Americans, Latinos. I want to put the my native sisters and brothers to the side for just a moment, and some of the other groupings that find themselves on these lists is what has caused alarm across the nation. So, Chicago, the numbers are the same. Philadelphia, the numbers are the same. San Francisco, the numbers are the same. We're all aware of meat processing and packaging companies that I probably never knew that much about up until recently, that have 4,000 and 5,000 people that work in one place, meat packaging and processing, with 1,900 infected persons in one facility. So it's just a shock that this question of color has come to be born. But this question of class, this question of poverty, and where it fits into this is not often brought up. So I wanted to highlight a couple of themes as I've been involved in this process. Now, several weeks ago, it was told to me on television programs that some of these major corporate entities were in trouble because the virus was showing up. And we're talking about in March. And right away, somebody put their hand in their pocket and found that elusive, doggone $1 trillion check. And how did that get in there? And found that check and signed it over to United Airlines, and found another one. How did that get in there? And signed it over to American Airlines, and all of these corporate people that were already starting to whine about the monies that they were losing. So right away, they got paid off. And then the next group of people, after it became clear that there was something going on, well, they went on off to their country estates and their homes, their gated communities, to make certain that garçon would be the one to deliver their food at the gate when they called it. So they left. And when the dust cleared, we looked around, and what we have are working class people. What we have are welfare recipients, welfare mothers, welfare children, the disabled, the elderly, veterans. That's who's here. And we're the ones that have to face the virus down. We're the ones that have to be the line of demarcation as this beast continues to eat up and devour members of our community. So one would think, and this comes out on the conference calls, that the medical teams, medical staff that are responsible for saving just thousands of lives, as they complain, we don't have enough hospital gowns, we don't have enough masks, we don't have enough gloves, we don't have enough, all of these things. And then a deeper dive into those wants seems to reveal that we don't have those things in America anymore. And those factories and those constituent development projects have been moved offshore. And of course, with moving productions offshore, here comes the less than minimum wage. Here comes the no benefits. Here comes that constituent group. And once again, in our American ignorance, we find that we have been duped. We find that we have been hoodwinked, shim-shammed, flim-flammed, and all the rest of the descriptions that indicate how we go through our corporate American lives, that people believe we all are the same, until a pandemic shows up on the front porch. And now we see that none of those things are working for us. We can't get testing. You can't buy those things that you think you need. Every day there's someone on TV talking about who can get tested and who cannot. And that conversation is based in access to testing kits and access to people that can provide the test. So all of these things are swirling around And then here comes this task force that's asked to take a look at these circumstances and come up with ways to bring down the numbers of people of color that show up exponentially and overrepresented in these figures, and then try to create some kind of long-term projects that would get at this. Well, I can say to you all, my sisters and brothers, there's struggle going on in this committee. You know, a lot of folks, well-meaning people, they go to the data that says in this community you have this, and some other pieces of information identifies another community that may need some things. And you know, the first couple, we've only been into this like 6 weeks now, and some of the very first pieces of information were all about data collecting, details, charts, bar graphs, and those kinds of things, which have a place. But it became clear that there was a free press article that indicated by zip code the number of dead and dying and infected persons, and the team needed to focus in on where to put the most energy to roll down some of those numbers. And I'm happy to announce that we have started to get into that process where we actually have some door to door. I know we're locked inside, but we're doing some door to door, neighborhood by neighborhood, community by community broadcasting in cars with those broadcasting systems with the microphone and the loudspeaker, I mean, on the roof. So we've gone back to old methods that always worked. And the neighbors are coming to the porch because we're playing Can't Touch That and all those kinds of things. And people come outside to see what's going on. And announcements are being made about where you can go to be tested for free. So we're managing this kind of a task. There is tremendous race and class disparities that are going on. We still do not have enough testing kits for the zip codes that are in Detroit. The concentration right now is in 48235, 48221, 48219, 48227, and 48217, which is in Southwest Detroit, the last one. The other four represent the highest four zip codes in the entire city that have the most COVID infected and dead list. If you add them all up, they represent almost the exact amount that all the rest of the zip codes come in with altogether. It's that intense. So it's a lot of elderly, a lot of retired persons, a lot of senior high rises, a number of those kinds of conditions that live in those first four zip codes that mean something about why these numbers are so high. I would say this last thing, and in an effort to try to, save a little time for folks that may want to ask questions at the end. I work with the Michigan Welfare Rights Organization, and we have one focus, and that is to eliminate poverty. And to eliminate poverty, I know people start quoting the Bible at me, where Jesus is supposed to have said the poor will always be with you, but that's not accurate. They leave out the rest of it, and the rest of it is the poor will always be with you as long as you ignore the needs of the poor. In other words, people don't have to live the way we're living. We've got high-tech technology as exhibited by this tremendous activity today that my little note says there are 20-something people on this one phone call. 10 years ago, 15 years ago, well, I never heard of anything like this. So we're able to connect all of this together. We're able to develop housing. We're able to find all kinds of things. We can build cars for everybody. We can put people in houses. We don't need to build houses in Detroit. We have plenty of vacant houses. All we need to do is to find the creativity and the courage to get a paintbrush and go hire some of those laid off carpenters and pipe fitters and go clean those places up and move people in, which, by the way, we're quite good at, expert in doing that kind of thing. So this is an issue of race in terms of people not showing up on these lists the way they should, but this is also a wake-up call. We absolutely are not able to indicate what to do when a virus or an emergency like this happens. Totally unprepared, even as we learn more and more day by day. So this is our Katrina. I say that all the time as a member of this task force. We have to find a way to do for each other and to take care of each other. And we're doing that. And we should make no bones about it. We're not going to get any federal help. That's out the window. And to the degree that we could save lives and provide testing and then provide the aftercare for testing that people will need so that they can try to survive this doggone thing. When we used to play that game tag, and at the end of tag, you touch someone and you would say, "You're it." Well, this is it. This is it. My name is Maureen Taylor. I serve as state chair of the Michigan Welfare Rights Organization, and I will end my comments right there. Thank you for including me.
Thank you so much, Maureen. That was really, really great. It was very informative and it was very invigorating. I think we will be having a discussion at the end, and there will be plenty of time to ask questions. I'm sure a lot of people might have questions for Maureen. I definitely have questions, but instead of going into that now, let's go ahead and go into our next speaker. So Abiyumi Azikiwe of Moratorium Now Coalition is going to be giving a presentation. So Abiyumi, take it away.
Well, thank you so much, Jason. And first off, on behalf of the Moratorium Now Coalition, I want to thank the Interreligious Foundation for Community Organization and Pastors for Peace for participating in this webinar with us. Also our allies with the Michigan Welfare Rights Organization. We work with both organizations locally and nationally for years. We've worked, of course, with the IFCO Pastors for Peace, with the Cuba Caravan, the Docs for Detroit project, where we supported medical students studying from Detroit in Cuba, and also the Martin Luther King Day Committee, where last year we had Gail Walker, Executive Director of IFCO, as our keynote speaker. And this year, Dr. Luis Barrios, who is a board member of IFCO, joined us on January 20th in Detroit. I just wanted to mention that Detroit has been disproportionately impacted by the onslaught of the COVID-19 pandemic, which began in early mid-March of this year. We're talking about less than 2 months ago. The whole situation in Detroit, in Michigan, throughout the United States, and indeed the world has been turned on its head. Now in the US, there's been almost no preparation by the municipal administration, state government, and the federal government in advance of such a tremendous healthcare and the subsequent social crises that we're facing right now in the United States. The majority of the African-American population in the city, of course, which constitutes about 80% of the overall residents of Detroit, are working class people. Now, these are there are large numbers of people living and working in Detroit without health insurance. There are several thousand households who do not have running water in their houses and apartments. There's environmental degradation due to industrial production, failures in waste management, and that's linked to the proliferation of respiratory illnesses in the city of Detroit, such as asthma, all types of respiratory difficulties. And as Maureen was saying, with those zip codes, a lot of these, what they call comorbidities, parallel these zip codes throughout the city. Now, the living and working conditions cannot be excluded from any assessment of the rate of infections and deaths since the advent of COVID-19 in the city and in the state of Michigan. These same factors are also relevant in other major urban areas throughout the United States. Moreover, and this is what is so striking, the United States, which is the largest capitalist economy in the world, is now the epicenter of the worst pandemic to inflict North America and Western Europe in over a century. We would probably have to go back to the influenza epidemic of 1918 through 1920 to compare the level of deaths, sicknesses, and displacement that occurred. Now, the current administration of President Donald Trump even ridiculed the notion of a potential pandemic. Now, this is just 2-3 months ago. He has utilized racism in an attempt to stigmatize the country of China. The daily White House briefings that are led by Trump and Vice President Michael Pence often degenerate into denunciations of China, along with the World Health Organization, to which the administration suspended funding just 2 weeks ago amid an international medical emergency. Trump has accused the World Health Organization of being biased in favor of China. He also falsely asserted that the Geneva-based United Nations affiliated agency, the World Health Organization, did not inform the United States of the severity of the COVID-19 infection rates. However, the allegations are discredited by both China as well as the World Health Organization. Information on the character of the virus and data related to its spread and effect on people was widely shared with the international community beginning in late 2019 and early 2020. This documented information, and any journalists or anyone who can read and write and are aware know that what the president is saying is totally false. The accusations made against China cannot conceal the hard facts that the United States has, as of early this morning, 1,193,813 COVID-19 cases and 70,802 deaths, by far more than any other country in the world. With pressure by the capitalist corporations to reopen, quote, and I put that in quote, reopen, unquote, the economy, which would force people back to work, and the remaining jobs and businesses that are still going on, without an organized resistance movement, it's inevitable that there will be another surge in infections and deaths in the United States. The experts have warned about this, and of course, this will be the situation. Now, as of today, the number of confirmed COVID-19 cases in the state of Michigan, as Maureen mentioned, and I want to reiterate this because it's staggering. It's difficult to even get our minds focused on these numbers. 43,950 cases, that's of this morning. I just heard a report earlier where there were more. And there's been 4,135 people that have lost their lives to the illness. And that could very well be an undercount, because a lot of people who want testing cannot get testing. A lot of people who have died without testing have not necessarily been registered as COVID-19 deaths. There's been higher concentrations of infections in larger urban and metropolitan areas. For example, Detroit, we're a hotspot, and Flint as well as a hotspot. In Wayne County, there are 17,667 cases of COVID-19 as of this morning. staggering. Detroit is the seat of the county, and in the city, there are 9,566 confirmed cases of COVID-19 and 1,147 deaths just over the last 2 months, less than 2 months. Data on the racial identity of those infected indicate that African Americans, who make up 14% of the state's population, are represented in 32% of the cases and 41% of the deaths related to the pandemic. Nonetheless, the rate of infections and deaths are declining significantly in Detroit. And I believe a lot of this has to do with the fact that the majority of people appear to be abiding by the social distancing and other preventive measures and guidelines. Many businesses remain closed. The schools, K through 12, are still closed. Colleges and universities. Most office buildings are closed. Most plants are closed. Construction sites, etc. And abidance to the stay-at-home orders issued by Governor Gretchen Whitmer in March, during mid-March and later. Now, second, I want to talk about the economic toll this has taken on Detroit and the state of Michigan. There have been approximately 34 million people who have filed for unemployment benefits in the United States overall within less than 2 months. 34 million people have filed for unemployment benefits in this country in less than 2 months. We have automotive production, service sector jobs, educational institutions, and even healthcare facilities are furloughing people and laying off employees. Astonishing. In Michigan, a hotspot for the coronavirus pandemic, Ford Hospital, Beaumont Hospital, even the University of Michigan Hospital are laying off thousands of healthcare workers. In Michigan, over 1 million people, it is said, are jobless due to the existing crisis. Now, the city administration in Detroit has already instituted an austerity budget for the next 2 fiscal years in anticipation of the drastic reduction in tax revenue, which has been fueled by long-term, which is going to be fueled as well by long-term structural unemployment. There are untold number of workers applying for unemployment benefits, and they have met bureaucratic barriers to getting paid. The state websites for jobless claims are often stalled. Phone calls go unanswered for hours. Others have been denied benefits for spurious reasons, which are non-monetary. Now, the hostile posture and character of the state government in Michigan as a policy, it was adopted as a hostile policy under the previous administration of Republican Governor Rick Snyder, have not been adjusted by the Democratic successor, Gretchen Whitmer. So therefore, the problems that existed in regard to applying for unemployment benefits under Snyder still exist today, even though the crisis is far worse. And in other areas, the same bureaucratic obstacles exist. Now, the automotive companies are planning to phase in production beginning on Monday, May 11th. These decisions come with profound risk. If there are COVID-19 outbreaks in the plants, which exceed the previous cases, the facilities will be forced to close down yet again. Most importantly, with more than 35 million people without employment, the demand for consumer goods will inevitably decline drastically. People won't be able to afford to buy cars. They won't be able to afford to purchase durable goods, even food. We see the food banks are being worked to overcapacity. Now, this much championed, nationally championed public relations campaign, which has suggested for the last 5 to 6 years that Detroit is undergoing an economic resurgence, is largely based upon developments in the service and hospitality sectors of the economy. Obviously, a major setback for this narrative has been the closing of the casino hotels downtown. and they will remain shuttered for many months to come. And this is going to be depriving the city of Detroit as a municipality of tens of millions, if not hundreds of millions of dollars in tax revenue. Now, many people's healthcare coverage as well is indeed linked with their jobs. As a consequence of rising unemployment and poverty, more workers and their families will be forced out of medical insurance plans, furthering the burden being placed on hospitals. Also, public transportation will undergo cuts in service routes, while the schools have no plans to reopen anytime soon during 2020. Plans have been announced to provide laptop computers and tablets to K through 12 students for the purpose of online learning. But this is going to be a process, and it's not going to be easy to transfer from in-house learning to online learning, considering the other factors involved: utility shutoffs, overcrowding in homes, sicknesses in homes, etc. Now, prior to the Great Recession of the 2000s and the subsequent imposition of emergency management and bankruptcy in Detroit, this took place between 2012 and 2014, Detroit was transformed from a majority city of homeowners to renters as a direct result of the lack of legal guarantees for renters. For example, there's no price controls, there's no rent controls in the city of Detroit, as far as I know. There's no ongoing guarantee of moratoriums on payments of rent, and also the fact that there's a lack of available low and moderate income housing in the city. Rents have been going up. And instead of trying to control this, the city administration and other interests have been championing the rising of rents and the escalation in property values, which of course impact negatively on working people and the poor. So this, of course, will force more people out of the city of Detroit center. And we've been saying this for a number of years. More people have moved to the suburbs, more people are going to rural areas, and more people are moving to other states. And this pattern has been on the ascendancy for many years. And unless there's some real organized fight back movement, it's going to continue. The economic imperatives of the ruling class in the United States at this time is to force people back to work, irrespective of the failure to provide safeguards from the infection. We have witnessed with great dismay the spread of the pandemic in the meat processing plants around the United States. Many of these are in the South. Many of the people who work in these plants are African Americans, are people of Latin American descent, other people of color communities, poor people, and marginalized working class people. People are paid extremely low wages, and even before the pandemic, the health and safety conditions in these facilities were deplorable. Even in plants in Michigan, several workers have died as a result of the COVID-19 pandemic. Now, these workers who have spoken out against the lack of personal protective equipment, PPE, and other safety issues are routinely disciplined, and some have been terminated in the hospital system as well as in the automotive production process. So in concluding, I want to mention that the Moratorium Now Coalition was formed in 2008, some 12 years ago. It was formed amid the worst economic crisis since the Great Depression, which occurred between 1929 and 1941. At that time, in 2008, we demanded an immediate halt to all foreclosures and evictions while fighting in the courts and on the streets to save the homes of people living in the city and around the state of Michigan. Later, we expanded our focus to challenge DTE Energy as their profit-making objectives often ignored the fundamental human rights of people in regard to utility shutoffs. and the subsequent peril associated with such measures. People died in this city because of lack of heat, because of lack of electricity, and because of the lack of water. By 2014, when water shutoffs reached epidemic proportions as a direct result of the illegal emergency management regime and the illegal bankruptcy, we, along with allies, exposed the link between the financial institutions and the denial of tens of thousands of working people their right to water. Today, these demands remain relevant to the situation in Detroit, the state of Michigan, and indeed the United States as a whole. In a daily briefing from New York Governor Cuomo earlier today, on May 7th, he extended a moratorium on evictions for another 2 months in New York State. That demand should be instituted as well through executive order by Governor Whitmer. In Detroit and the state of Michigan, no one should be foreclosed or evicted in this period. Absolutely no one should be put outside. This is only going to exacerbate the public health crisis even further. This same moratorium should apply to water and utility shutoffs. In fact, rents and other payments should be waived until the economic situation in the state reaches some level of stability. These demands extend in regard to our request for Cuban medical assistance to the people of Detroit and the United States as a whole. The socialist orientation of Cuban healthcare methodology is much needed in a city where racism and national oppression and class exploitation has rendered hundreds of thousands jobless and threatened with financial ruin. Judging from the history of resistance in this city, the workers and oppressed will use this to rise to the occasion. Prior to the pandemic, there was already a rising political ferment related to the housing demolition projects that the city so grossly mismanaged, the federal funds that were redirected from assisting people to carrying out demolitions at extortionate prices, the tax captures which have stolen hundreds of millions, if not billions of dollars from working people in Detroit. And right before the pandemic, the whole upsurge around overtaxation of properties in the city of Detroit to the tune of over $600 million, if not more. Undoubtedly, the economic and social crisis will spark more layers of society into political action and organization. And we look forward to that. And I can end right there. And of course, we can take up these issues as well in our question and answer period. Thank you so much for listening.
Amazing. Thank you. That was fantastic, as always. Abiyemi, hard-hitting and very formative. We are going to have time to ask questions, as I said before, again at the end. But right now, I am going to have Gail Walker is going to give a presentation. But before we do that, I'm actually going to be showing a short 2-minute video about Cuba, and specifically it's about the door-to-door doctor service in Cuba. So stand by and we'll have that in 1 minute.
Es una enfermedad que está azotando a todos los países en el mundo. Nuestro país no es la excepción. nos hace sentir muy orgullosos que nuestra población sienta que las cosas que hacemos pues son de beneficio. Realmente esa es nuestra razón de ser.
Okay. I got a message from someone that it was a little bit glitchy and sound may have cut out, I think. If you want to watch the video again yourself, put a link in the chat. That video, I'm not sure, it's made by a group called Belly of the Beast Cuba. It's a YouTube channel that has about 5 videos about Cuba, and they all seem pretty good, so recommend that. And as I said earlier, next up we have Gail Walker, Executive Director of IFCO, Interreligious Foundation for Community Organization. So go ahead, Gail, you've got 20 minutes, once again, by the way.
Great, thank you, Jason. It's an honor to be with you all tonight. I want to thank the Moratorium Now group for organizing this event. And I always learn incredibly important information whenever I'm in or around Detroit. And I mean that sincerely. So I thank you all for your informative presentations. The topic of COVID-19 and the impact that it's having in the US, coupled with what Cuba is doing to fight the pandemic, has been the topic of multiple webinars, and it's understandable given the real, juxtaposition between the way that the two countries are handling this or not handling this situation. So it's informative and I think important and timely that we're doing this tonight. So thank you. As my sister Lisa Vellante earlier shared, IFCO has IFCO, the acronym for the Interreligious Foundation for Community Organization, has a long history in multiple movements of struggle. For more than 50 years, IFCO has stood as an organization committed to social justice, from supporting the rights of women, children, workers, supporting the enfranchisement of Native Americans, political prisoners, fighting the violence of the Klan, the Ku Klux Klan, and US government repression here in the US and abroad, in Southern Africa and parts of the Middle East and Central America and the Caribbean. So it's really been a very broad based paintbrush that we use to attack issues of injustice. And so since 1967, IFCO has stood for justice. And part of that history has involved Cuba's work to oppose the US government's longstanding blockade of Cuba. And through our educational campaigns, including the caravans, delegations, informational webinars, IFCO has worked to break the information blockade on Cuba. Too often the US, with all of its power and resources, is able to control the narrative. That has been the case with Cuba since the triumph of its revolution 60 years ago. The negative image of Cuba has permeated just about every aspect of life, making it challenging for the truth to rise to the top. And the truth is that Cuba is not the villain that the US attempts to paint it as. While not perfect, no place is, tiny Cuba, with its limited resources, has offered to share what it has with the rest of the world. And a current example of this generosity in Cuba's effort to share its medical help to fight is its fight against coronavirus. Cuba has sent medical brigades, as many of you know, to many countries to help curb the pandemic. We've seen plane loads of Cuban medical professionals being welcomed in China and Italy and South Africa, Suriname, and many other countries. All of these medical professionals, they are risking their lives to help fight the deadly virus. And this isn't the first time that Cuba's offered this kind of selfless assistance. In fact, Cuba has never wavered in her support of those who have struggled for self-determination across the globe. Fighting alongside African freedom fighters, Cuban soldiers struggled feverishly to crush the racist South African army and the fight against apartheid. And indeed, whenever Africa has called, Cuba has answered, not just then, but throughout its 60 years of revolution. More recently, there was the brave commitment of Cuban doctors to fight the deadly Ebola crisis in Western Africa. But Cuba's international reach stretched much further than Africa. And we can never forget revolutionary Cuba's focus on exporting doctors and in some cases engineers to help a critical lifeline, to offer a critical lifeline wherever a disaster struck, from the devastating Hurricane Mitch in Nicaragua and Honduras to the catastrophic earthquake in Haiti, from the horrific Chernobyl nuclear disaster in present-day Ukraine to the deadly tsunami in Indonesia. Cuba was there. And Cuba was there in Mexico and Puerto Rico, Brazil, and the list goes on and on and on. We know that Cuba has successfully manufactured medical treatments that the world can benefit from as well, including those in need here in the United States. And perhaps one of the more well-known Cuban innovations has been the vaccine Simivax, invented by researchers at the Center of Molecular Immunology in Havana. Simivax targets a growth factor in cancer cells in a way that can arrest the spread of the disease. And it can be used as both a treatment for lung cancer patients and a preventative measure for people at high risk of the disease. Another treatment that some have heard about that Cuba has manufactured since 2006, I believe, is a drug for foot ulcers called Herbiprot P. And that prevents the need for amputations by accelerating the skin's healing process, closing a wound safely over the course of about 3 months. And this is not just a political debate, it's a potentially life-saving issue, given the fact that tens of thousands of US adults with diabetes have lower limbs amputated. And studies have shown that that procedure is linked to increased risks of early death. And then of course, today, Cuba has taken on coronavirus. Cuba is successfully administering the human recombinant interferon alpha 2B for COVID-19 patients. The effectiveness of interferon alpha 2B has been proven in other countries like China to fight the disease. It's not necessarily a cure, but to at least to slow it and to help fight it. In Cuba, it is included in a protocol established by the Ministry of Public Health in combination with other drugs in the case of confirmed patients. IFCO is currently participating in a global project called Saving Lives that is calling for Cuban doctors to be allowed to come to the United States to share their expertise in the fight against COVID-19. More than 200 medical professionals, academics, elected officials, and concerned multi-country residents have endorsed a statement calling for medical, clinical, and scientific collaboration with Cuba, incorporating Cuba's interferon alpha 2B recombinant in clinical trials and ending the attempts to stop other countries from accepting Cuban medical assistance and measures preventing Cuba from importing medical equipment and medicines. So in this moment, when the planet is facing a pandemic and the lives of human beings are at risk, solidarity and collaboration are critical, are really essential, and no source of life-saving expertise can be sidelined in the fight against this new disease. And that's why IFCO and countless other groups have joined together to really formulate this project under the banner of saving lives. There's going to be, I think, a slide at the end that will give us information on where others might consider endorsing this project. It's really an important way for us to continue to talk about bringing resources here that are so desperately needed, as was noted by the previous speakers. Another important tool that Cuba is putting to use to combat the pandemic is contact tracing, referred to in Cuba as pescasaje. This is the process that you just saw in the previous video of identifying people who may have come into contact with an infected person. As you just saw in the video, the process of going door to door to communicate with residents has been used for other medical outbreaks in Cuba, including the fight of dengue fever. Medical professionals, medical students visit neighborhoods and question them about how many people are living in the house, whether there's anyone in the house with symptoms, etc. This information is then provided to the family doctors responsible for that neighborhood. And it's a way to identify and contain the virus, which is critically important for a small island nation working to combat disease and death. And in fact, Cuba reports not only does it have this wonderful critical tool, but it also reports that there have been no outbreaks. I want you to repeat this: no outbreaks or positive cases of coronavirus in Cuban prisons. Despite the catastrophic death toll worldwide, Cuba has reported that there have been no outbreaks in prisons. The Cuban Ministry of Health has said that this is a result of measures implemented by the Medical Services Division of the island's Ministry of Interior to prevent the introduction of the disease in any of its units. To accomplish this, disinfection of hands at all points of access to prisons, prohibition of access to workers or visitors with feverish cases and respiratory symptoms, mandatory use of face masks, and twice daily screenings of the prison population are just some of the measures that Cuba has taken. And all inmates who enter the prison units from the community are separated from the other prisoners for at least 15 days. The experts and the medical experts in Cuba also indicate that the homeopathic formula, multiple formulas have been put to use as alternatives to increase the immune system, to increase immune systems for the populations at risk against viral infections that have been massively supplied. So the affirmation that isolation centers were created in penitentiary centers for patients with respiratory symptoms, and that there are conditions for medical transportation to evacuate anyone who is ill is also, been a key part of the success that Cuba has been able to achieve in this regard. Cuba's medical experts say should outbreaks of the virus occur in any of those establishments, that then they will begin to quarantine them as well. And even the UN High Commissioner of Human Rights, Michelle Bachelet, has encouraged governments to release inmates who are especially vulnerable to COVID-19, such as older people, as well as low-risk offenders. And Cuba has done just that, is released more than 6,500 prisoners. Now, if you take that information and compare it to other places in the world, it's very telling, because we know that prisons are a hotspot for COVID. Experts say we'll probably never know the extent to which COVID-19 has penetrated the world's prisons and detention centers. Globally, the picture is horrific. A few examples, just a couple. Haiti's prisons are running at 450% occupancy. More than 773,000 people are imprisoned in Brazil in a system built to hold only 460,000 people. Meanwhile, in the US, about 2.2 million individuals are incarcerated. No other country imprisons as many people. And according to the executive director of the Federal Defenders of New York, which defends people who have been charged with federal crimes but can't afford to hire an attorney, it's hard to imagine that the virus is not already rampant throughout the US penal system. In the Marion Correctional Institution in Ohio, which holds 2,500 detainees, according to a weekly peer-reviewed medical journal called The Lancet, more than 2,000 of 2,500 of the people behind bars have been tested positive for COVID-19. So the comparison is very startling. And just again, we see that Cuba, has offered an example of what it takes to really put people first and to really fight this pandemic. I'm hopeful that there's going to be, a healthy conversation and questions afterwards. So I don't want to talk too long, but I do want to end by just conclude by talking about a project that's very near and dear to many of our hearts, my heart, many of us, and that's the Latin America School of Medicine, known by its Spanish acronym as ELAM. And ELAM offers a wonderful scholarship program that Cuba has provided for young people from various countries to study medicine with no cost, with the only commitment being that they'll return home to practice in communities of need in their home country. This project is well known in Detroit, as Brother Abayami just referred to. There's a group known as Doctors for Detroit that has worked with IFCO, that has worked to identify people who are able to take advantage of this opportunity. My father, the late Reverend Lucius Walker, who was the founding director of IFCO Pastors for Peace, and Reverend Joanne Watson, a Detroit community leader and former city council member, worked together to kick off Detroit's involvement in recruiting for the Elam Scholarship. And there are many from Detroit, the Detroit area, who have benefited from this incredible program. And at least one is currently in residency in the city. This is another example of Cuba's medical internationalism, of Cuba training young people, as only Cuba can train them, to then return and serve in communities of need, to do pescasaje in Detroit, to do pescasaje in the South Bronx, to do pescasaje and wherever the need may exist in our communities here in the United States. And that's an incredible gift, courtesy of Cuba. In fact, despite its limited resources, Cuba has continued to export its doctors to various places in the world where need has arisen, and taken it even a step further by providing medical training for free of charge. For the past 2 decades, Cuba has trained thousands of doctors from more than 125 nations in Latin America, and as well as the United States, the very country that's blockading it, to study at the Latin America School of Medicine under full scholarship. To date, Cuba has trained close to 200 US doctors to practice medicine in underserved communities across the United States. And it has been IFCO's distinct honor to assist in identifying young people, young US candidates for Cuba's scholarship program. There are currently 70 people from the United States that are studying in Cuba right now. And despite COVID-19, we are still in the process of receiving applications for potential scholarship recipients, hopefully in the fall of 2020. So as we work to revolutionize healthcare in the United States, it is indeed a blessing to have Cuban-trained doctors working in some of the most underserved communities across the country. And that commitment on the part of the graduates is being put to the test at a time when we need it most during this coronavirus pandemic. So time and time again, Cuba has illustrated its generosity when the world has called, and those of us who support the struggle for justice know that we owe a debt of gratitude to our Cuban family. And that's why I'm encouraging you to join us in our fight to end the US government's genocidal blockade, to end all restrictions on travel to Cuba, and to return Guantanamo Bay to Cuba. There are many different ways that you can be a part of this work, and I'm hoping that you will join us in calling for regime change in the US and not in Cuba. I want to end by expressing once again, my deep appreciation to Moratorium Now for hosting this event tonight. Our solidarity work with Cuba is a true labor of love, but it does cost IFCO money to organize our caravans, to coordinate our delegations, to run the Elam Scholarship Program. So I want to encourage all of you to support IFCO's ongoing work to and to consider, making a generous contribution today. Had coronavirus not hit, we would have been with you in person as part of our annual Friendshipment Caravan. Lisa Valente, my dear sister, was scheduled to be in Detroit. She would have been there, and I would have been rooting her on, as I might have been in another city at another time. We continue this important work despite the virus, and we do it out of our love and commitment to Cuba and to the solidarity that Cuba illustrates. And while we are socially distancing, our solidarity continues, and so does our work. And that's why we need you all to help us to move forward. We don't get corporate funding, thank goodness. We are not the airlines, as Maureen was referring to earlier. We're not the corporations that have been literally getting rich off of this pandemic. Our funding, our ability to do this work is thanks to the donations we receive directly from you. So we're asking you to please donate. I don't know if John's been able to put up the screen there that shows, there it is, that shows the different ways that you can donate. There's 3 different ways. You can text the word IFCO to the number on your screen, 646-859-5344. You can go to our website, ifconews.org, and there's a donate now button, or you can send a check to the PO box that's listed on the screen. So there's a variety of different ways that you can be supportive of this work. We hope that you will consider making a regular pledge, maybe $10, $25, $100 a month, whatever you're able to do. Consider donating a part of your stimulus check. Many people have made a commitment to do that, and we're immensely gratified by that. Whatever you can do, anything that you can spare would be deeply appreciated. So we hope that no matter what, that we can continue to do this work, no matter what, no matter how you decide to show your support. We thank you in advance for joining in this incredibly important fight that we're going to continue to do. We're going to continue to be in solidarity with our friends in Detroit and those across the country, Lisa Valente in Pittsburgh and various other cities to do this work. So thank you. Thanks for being with us, and thank you for this opportunity to share with you a little bit about some of the work that not only that IFCO is doing, but more importantly, that Cuba is doing on the front lines in this fight against this horrific pandemic. Thank you.
All right, thank you. Thank you, Gail. That was a really wonderful presentation. We're really appreciative of all the work that you're doing, and everyone's presentation tonight has been so amazing. Thank you, everybody. I'm just gonna move pretty quickly through a short little rundown of what our campaign is all about, AMAC. And while I do that, I'm just gonna share my screen real quick. Let me get that set up. All right, can everybody see this?
Yes.
Good, okay. All right, so again, thanks everybody for your presentations. We heard from Maureen talking about what's going on in Detroit. We heard from Abayumi talking about what's going on nationally and in Detroit. And we now brought it home, bringing it back to talking about Cuba and what Cuba does. So as I said in the beginning, Moratorium Now, we're a group that meets every week to deal with issues that are going on in Detroit. And as soon as COVID-19 began and we saw the kind of response that Cuba was having around the world, and we saw what was about to go down in our city and in our country, and what we have seen has turned into we have the worst outbreak in the world. We quickly gathered together to realize that what we needed to do was to pressure our government to allow what Cuba is so generously offering, and hope that they would extend that also to us, because we need it so badly. So we started this group, Allow Emergency Medical Aid from Cuba, and we put together a statement, and we've been gathering endorsements. I think we have currently over 40 organizations and individuals who have endorsed our statement, and we are still urging others to continue endorsing it. So please endorse it if you haven't already, especially on behalf of an organization if you're a part of one. I'm just going to quickly read through this. Governor Whitmer has the emergency authority under MCL 30.404 to enter into reciprocal aid agreements with other countries to obtain food, clothing, medicine, and supplies to meet the crisis. There is an exception to the U.S. blockade against Cuba for the importation of Cuban medicines under 31 CFR 515.347. So we put together two demands, or requests rather. Join us in requesting that Governor Whitmer, on behalf of the people of Michigan, issue a formal request for medical aid from Cuba. One, Detroit needs the medications that Cuba has been developing and using successfully worldwide to fight COVID-19. Interferon alpha 2B stands out across the world as a serious option with promising results. We call for the governor to set up a team of medical experts to examine its efficacy as a treatment for COVID-19 and present their findings if positive to the FDA for approval of its distribution and use. Two, Governor Whitmer should extend an invitation to Cuba to send medical teams experienced in fighting pandemics like the COVID-19 to help treat those most affected in Michigan. So we have a statement online. You can follow this link, and I will put this link in the chat window. You can click on that, go to read our statement, which is what I just read. And at the bottom, there's space for you to endorse. We hope that you will endorse it. We are going to be presenting this to Gretchen Whitmer. We're also going to be having a phone bank calling Gretchen Whitmer at these numbers. And we will be shortly, this is sort of the official launch of our campaign. We are currently putting together a calling, email, and tweeting scripts that we'll be actually putting together in our next Moratorium Now meeting. We'll be sending that out this week. If you heard about this event, you'll be hearing about this. And also please come back and check back with us about our progress on this. But we will be asking everyone to please call and put as much pressure as possible. And we'll keep doing it until we're really heard. We have certain targets, including other doctors have been added to the list. I may ask some of my Moratorium Now members to talk about that. But basically, here are a few photographs we wanted to include. Cuba. It's really amazing to me always that Cuba has an army of doctors. I mean, how great is it to be, invaded by an army like that and not a different kind of army. As I said, we have our weekly organizing meetings. Now they're on Zoom every Monday at 7 to 9. Please join us, especially on Monday. We're going to be finalizing some of the details of this campaign. Also, in addition to this sort of statement, phone banking part of the campaign, we've had a lot of discussions with different folks and different organizations as we've tried to roll this out. We've also developed another idea of the campaign that would be more of a grassroots organizing effort. One of our intentions is to basically try to adapt the medical model of Cuba, in addition to also asking and hoping to receive help directly from Cuba. This would involve organizing folks from the medical community and just neighbors to get together and hopefully be able to go out, go door to door, help distribute PPE if we can get our hands on it, distribute and whatever we can give, and also just ask about our neighbors, sort of institute the model that we feel is lacking. And that'll be something else that we haven't really developed, but we will be discussing that at our next meeting. So I hope some of you can join us. And that's basically it. I'm going to grab the link of our statement. I'm putting it into the chat window right now. And also, I would love it if any of my other Moratorium Now comrades want to chime in. I may have forgotten to mention something important about our campaign. Does anybody else want to add something? I know Sarah and Verbena, you guys have been two people that really have contributed a lot to the campaign so far. Sarah has designed our great logo, and Verbena has been a really good organizer as well. Do either of you guys want to add anything to what I said?
Yeah, this is Verbena. Can you hear me?
Yeah.
Thank you. And first, just to those of you who've been doing work in solidarity with Cuba for decades, thank you. And my gratitude to all of you who work to end poverty and just make, you know, a more just society. I just wanted to add that we are going to, after this meeting, we're also going to work on creating an online space for AMAC. So we want to put videos and audio articles and photos supporting the AMAC campaign. It will hopefully be a place that makes it clear that medical collaboration with Cuba is crucial. You know, I suppose we might even have to educate about how long this virus will be kicking around longer and more fatal yet if we fail to follow the best practices of prevention and tracing, testing, and care, all of which are being modeled by Cuba and also in Vietnam and China, some other places. So we want help, you know, putting different videos or, you know, like this meeting. I think it's been amazing education and humanity. You know, we could put this up on the AMAC online space. And yeah, we're really, as in most campaigns, but we really want this to be an educational push. And we're hoping that even though many people in the US for years have bought into the anti-Cuba propaganda, we're hoping that given this pandemic, during this time, people might put their bad attitude and their, you know, their misinformation and prejudice aside and support seeking help from Cuba if they can be educated enough to believe that it will help. And so we also, you know, just invite folks to help us create the public pressure that's needed. And that's about it. Thank you for this wonderful meeting.
Excellent. That was great. Thank you, Verbena. One other thing I forgot to add, I should have mentioned it while I was going through presenting, but if you click on our link to our statement, you can scroll down to the bottom, and we actually have a link there that links to many articles that we've collected together, and it's just articles that pretty much deal with COVID-19. Some of them are about Cuba's work on other certain drugs, like drugs that they've developed for cancer. But if you're interested in learning all about Cuba and how their medical model works, I really encourage people to click on this link at the bottom of our statement and take a look at some of these articles that we've collected. There's even a PBS episode about Cuba's work with cancer, which is really, really great. Some of you may have seen it. And just a lot of information from a very wide array of media sources. So it's very good in case you want to take something and post it to social media. You can kind of choose the media source of your choice, if there's one that you like, and just talk about it online. I think a big part of this, as Verbena mentioned, is it's an education campaign. So we encourage everybody to post about this in social media. So I think we should go ahead because we have about 25 minutes left and invite folks to ask questions to the various speakers. So if you'd like to ask a question, please just use the raising your hand feature in the participants column, and I will call on you. And if you can't figure out how to do that for any reason, just wave your hands around and I'll call on you. So does anyone want to ask a question to any of the speakers? It could be anyone, Lisa, Maureen, Abiyumi, or Gail. Not seeing anyone yet. Anybody want to ask a question? I'll start it off actually. I wanted to ask a question to Maureen, and I think, Maureen, you began touching on it towards the end of your talk, but can you talk a little bit more about what the, I guess it's the COVID task force or response force that you're a part of, and what some of the plans are to actually begin to roll out? Because I think they might have a little bit of something to do with what we've been thinking about in terms of just getting out into the neighborhood and starting to reach out to folks directly. So can you talk more about what that group is preparing to do?
Yes, the focus is supposed to be on what can happen to impact the numbers of people of color that are showing up on those lists like I indicated. So starting last week, let me check, that would have been starting May 4th. There was already a list put together, and so multiple sites had started to experience testing. And we were glad of that, but it still wasn't enough testing. So the conversation, and I'm going to just read it to you, it's not in what do you call it, in firmed up yet. We're going to set up a site almost immediately, and almost immediately, I'm not sure what that means yet because we're still having to contract with medical providers to bring the kits, the testing kits, to where we say. So we're going to set up an area over at WC3, Wayne County Community College, the Northwest District, the Northwest Campus, which is at West Outer Drive in Southfield. That's going to service 48219, one of the top hotspots. And that'll be, again, I'm not sure when, but once you get over to that campus, for those that know what that campus looks like, drive up. You drive down West Outer Drive, turn right into the gate and turn right again to go to the parking lot area. For folks that would be walking, they would go into the next gate that's right next to it and turn left. The point being, we want to separate cars from people. So there's going to be a robust advertising activity. Signage will be put up on the gates of the college. Leaflets are going to have to be passed out at the gas stations and some of the community centers that are around there. There are two, at least, high-rise senior buildings, not convalescent homes, but senior buildings, and all of them will be leafleted. And there will be other opportunities to put leaflets in bus stop areas, all in that area. And again, it serves 48219. There are plans now to go to the Rite Aid that's up on Wyoming. And where is it? Wyoming and 7 Mile. That's 48221. And in that particular area, it'll be drive up and walk through. We're rolling that one out. And then the third immediate site will be the Northwest Activity Center, 48235. For those that know what that particular area looks like, we're talking about setting up drive-through testing in the back and walk-up testing in the front. Again, for those of you that know that area about the Northwest Activity Center, it's on Wyoming and Curtis. And right north of that corner, right north of the Northwest Activity Center, there's the Hartford Apartments for Seniors. and a couple of high-rise buildings. So it's a vested area in terms of community activities. 48213 over on the east side at Wayne County Community College at the Connor District. That's going to take a lot of work to get that one up and ready. It'll be the same situation. They drive up and they walk up. All the testing is free. We have to now consider the hours. I'm leaning toward 2 or 3, starting at 2 or 3 in the afternoon up until 5 or 6 in the evening, so we can catch a daytime crowd and we could catch the 6.5 people that are still working anywhere in Detroit. It might be 7 still working now. So to be able to catch up all of those areas. So the vulnerability piece has to do with the degree that we will be able to hand carry flyers with hours and locations to gas stations, to these mega centers where people are living. And the more challenging will be, how do we get these messages out to individual people in the neighborhoods? And of course, that depends on the volunteers that are around. And we're going to make a plea for volunteers as well. Folks can call us down in welfare rights if they have the time and the energy to help volunteer while we saturate these communities, to let people know that free testing is available. The rules and the regulations are not stringent at all. I believe that we said as long as you have one arm, you don't have to have 2 legs, you don't have to have 2 arms, you don't have to have 2 eyes. If you got just one arm, you're eligible to be tested. So everybody will be able to be tested and free at these sites. And we'll pick up on, if you turn out to be positive, we'll be able to do some follow-up activities. If you can't quarantine in your house because there are other people that live in your house, we're prepared with funds from the governor to put you up in a hotel for 14 days while we feed you and isolate you, and we'll take care of your family, all kind of things, which is an indication that says some of us know the wonderful things that happen in Cuba. And we're trying to come through the back door to make it happen and make it look like the same thing that our sisters and brothers do down in that area. So we're off and running.
Thank you. I hope we can keep updated with how your group progresses and how all those campaigns go.
I
Maybe
can send email information out to 1 or 2 members of Moratorium Now to keep them updated, and they, I'm sure, will be happy to share whatever that information is. But it would be my intention to try to alert as many people as possible to what's going on and the details involved. So I will commit to that level of communication.
Okay, great. Yeah, I'm sure someone will pass that along. All right, so looks like Mike, you want to ask a question?
I want to ask it to Maureen. You now know what our campaign is about. We want to actually bring in medical doctors from Cuba, or medical workers, I should say. They're not just doctors, but there's a whole suite of workers that we could bring in to help. In particular, Sinai Grace was one of the hardest hit hospitals. That's right next to 48219. They need doctors, and they need nurses, and they need other medical workers. We also need to have a way to bring in the Cuban drugs for clinical evaluation in some of these top-notch hospitals in the Detroit area. So I'm wondering, Maureen, if it would be possible for us to raise this with the commission you're on to see if we could get political support for doing this. We need to identify sympathetic doctors who may want to, engage in these clinical trials. We don't know how to get these things started, but these doctors know how to do it. And it would be great if you could help us with that. I know there are some other good activists on the commission that we could approach, but this might be one way that we could get to Whitmer to get her to do more than what she's doing right now. And it might also give her some cover, since it's coming from the commission. It shows that there's broader community support for what we're talking about.
Well, let me just share with you. We have a member of welfare rights that got this figured out already and had already been aware of the contingent of Cuban doctors that went to Italy and started to serve at the height or just before they reached the peak. So we had someone that already wrote to the governor about what needs to happen to get to some of these Cuban doctors and to bring them to Detroit. I have raised this already on the task force and asked a couple of folks, what did we need to do to try to get additional medical care, especially from those countries that seem to be willing to send medical personnel to the Detroit area. Right now, the response, there's always a response. And the response was, this is a very interesting idea, and we're going to study it. Well, you might be able to guess that the governor is in the crosshairs right now of number 45 because she gave the response, the Democratic response, when number 45 gave his State of the Union address. You all might recall, she came right back and gave the other response. So she's been on the target list for him ever since that time and holds Michigan as a hostage. I'm going to give everybody else the PEE and the masks and whatever else they need. And I'm going to do all of those things, but she can wait. So I say that to say this. I'll say two things. It's been mentioned. It has been asked of her. I don't know, and my guess is that it's not going to happen. And really, the logistical reason is because the numbers in Michigan are starting to go down. So the rationale, and it's been mentioned, and it's not a problem bringing it up to the governor and her team again. The rationale, I can hear it already, will be we would like to get them and we would like to reach out to them. Why don't we see if we still need them? Now, I also will say this other thing. It's been quite some time when I was first introduced to Hugo Chavez, and we got information from the from the Venezuelan embassy coming out of Chicago. And this was the first time members of welfare rights from around the country were invited to get to Houston, and the Venezuelans paid for that. Took about 35 of our members from all over the country, flew them into Houston, where you have to get the connecting flight to go to Caracas, Venezuela. And we sent a team of welfare rights folks there. That was the first visit. The next thing that happened was that the Venezuelans said, if you know folks that have problems with diabetes, especially as it relates to limbs and vision, because diabetes does something in terms of people's capacity to see. And once again, we sent about 80 people twice, 40 each time, down to Houston, get that connecting flight to Caracas. They were sent to Cuba, and where they stayed from anywhere from 2 weeks to 2 months. No money involved. Go there, and we can do something to prevent your foot from being amputated. We can do something to prevent you losing your vision. And these were Cuban doctors that had expertise about diabetes and what to do to intervene. And our folks stayed there, no Spanish speaking on our end, and came back with both feet and able to see. So this is 80, 85 people that we sent over a period of a couple of years, along with the Citgo gas oil that the Venezuelans were helping us to organize with help from Cuba to send oil all over the country where it was needed. So I do know that my Cuban sisters and brothers have tremendous skills. That's why we started asking the governor here quite some time ago, long before we got this task force together, what we might be able to do to bring some of those Cuban doctors here. So I have no problem in raising that question again and putting it in writing again, and I will report as the responses come back.
Thank you. Yeah, we will also be raising that question. Don't worry, we'll be putting the pressure forward. So, you know, we'll be helping out as much as we can. All right, so Gail wanted to ask a question, I think, and then it looks like Yvonne.
I mean, real quickly, I just wanted to just give appreciation to everything that you've been sharing, Sister Maureen. I think that the work.
And Sister Gail, I need to tell you, the last time your daddy was in Detroit at Central Church, I sat right in front of him and threw confetti at him while he was giving a hell of a speech. Okay,
all right.
Just wanted to share that. Yep.
All right, I appreciate that. I appreciate, and I like the image. I like the image. I like the image.
Yep.
Yes, yes. But I just wanted to say, just really to reiterate, if whatever IFCO can do to be supportive of this initiative. I mean, I know, you know, we're national. We're not local. But anything that we can do, we want to be supportive of. Number two is that if you're sharing information about the work that you are doing, to please, and we'll make sure through Mike, through Jason, through others, to get that information, because that's the kind of stuff that we would like to be able to also share, so that there are ideally, you know, other communities that are taking up these kind of initiatives. And then lastly is that I mentioned, I think, and I need to do my homework, and I should have done it before getting on. There's at least 4 or 5 people from Michigan, mostly from the Detroit area, that have been a part of the ELAM program. There is one graduate that's currently in residency now. And when I was talking about some of these doctors doing this door-to-door, that what they call pescasaje, and using that model in different communities, it would be wonderful to try to see, you know, I don't know, whatever kind of connecting and dovetailing we can do with the efforts that you were just laying out. But anything that you know, IFCO can do to be supportive, please count on us, and we certainly want to be able to share information about what's happening in Detroit with our national network, our national list of supporters.
I have a community daughter. Her name is Xochitl Williams Garcia, who we
I know Xochitl. Yes.
Yep. And she finished her courses, and she's one of our community daughters, and she's out in the West Coast in Seattle, practicing her trade right now. Yes. Excellent position. Yep.
That's very good. Very good. Yep. That's great. I was just speaking with someone about Xochitl earlier today. And I know John Waller knows her as well. Yes. Yeah. So there's a small world. We're all interconnected. But thank you. Thank you.
That's right.
All right. Yvonne, you had your hand raised. You want to ask a question?
To unmute I have one question specifically for Maureen. Hi, Maureen. Hey. And then one to the group. And I don't know, but I just wanted to know, Maureen, when does the task force on the coronavirus and the impact on Detroit and minorities, when does it meet, and are the meetings open to the public?
We are subject to the Open Meetings Act. So they're on Fridays between 3:30 and 4:30. There is a group task force report that is given. And then there are 2 smaller working groups. One is outreach and the other is, I want to say, policy. And they meet at a different time. But on Fridays between 3:30 and 4:30, there is a conference call every week. Oh, and you asked where they're open to the public. Yeah, because these are, the meetings are subject to the Open Meetings Act, and the access numbers and whatnot change every week because we're running from Zoom hackers. You probably heard about that. People that Zoom into the telephone calls and start saying ugly things and whatnot. So it's online to look it up, the Governor's Task Force on Racial Disparities / task force meetings. And that information would be posted every week so people can get on and can listen to whatever that call is. Yes, ma'am.
Okay.
All
Okay,
right.
thank you. My other, I have other part of my question. I didn't finish. If it's
Okay, right after that, Cheryl, and then Jerry. Go ahead.
Yeah,
You can go
I
ahead.
was just listening to Maureen, you know, when she was giving the locations for the potential testing or ongoing, but there are other sites as well where people can be tested. And probably, I was thinking a good project for the moratorium committee, Jason, to work on some consolidated list of all of the testing sites that we might be aware of that's in the Detroit area, to make people aware of the various options, because they're popping up. You know, I'm not going to say daily, but more and more of them are popping up. I know Triumph has one, Highland Park is proposing them. And the more we can get this information out about all of these sites, because to me, testing of everyone is imperative.
For sure. I hope that, Yvonne, maybe you can join us on Monday when we have our regular meeting, and we can make that an item. Okay, next, Cheryl had a question.
Well, not a question, but a volunteer. Maureen, it's good to see you again.
Hey, Cheryl. Hey.
I live in Northwest Detroit, and we have a great Cuba supporting block club here. We would be glad to help just do some door-to-door distribution. The block club president has a relationship with the senior building at Vern and Losser. You know, we've got that social distancing, those door-to-door dropping off flyers. So there's no problem doing that. You know, give me a call,
All right.
okay?
I will.
Awesome. All right, so rounding it out here, Jerry, you want to go ahead?
Raise one other, it's kind of a question, it's something to think about, is I know there's similar efforts to what we're talking about here being done in Canada as well. And one of the things is Detroit is right on the border with Windsor, Ontario. So one of the things that's been in the back of my mind, I think it's hard to do in the midst of the emergency, but of course this crisis isn't going to let up when the state of emergency is lifted, that if there's a way to find a way to bring in Cuban doctors to Windsor to have some kind of a clinic or something, that we could bring people from Detroit over to Windsor to get treatment as a way to circumvent the blockade in the US. I know the Canadian federal government hasn't been the most friendly either to this, but it certainly doesn't have as restrictive a policy as the US government. I just think it's something to think about, that if there could be like a joint effort, especially with us being on the border with right across the bridge and tunnel from Windsor, there may be a way to open up Cuban medicine and Cuban techniques to the people of Detroit who so need. If people could fly down to Houston, they certainly could get on a bus to cross over to Windsor to meet with Cuban doctors there as well. So I just wanted to throw that idea out there to put it in the burner to think about, not for tomorrow, but maybe for a few months down the road.
Good idea.
Yeah, I think that's a good idea to keep pushing as well. I mean, I'm no expert in this field, but I've been joining these Zoom meetings talking about Cuba for a little while now, and it seems like the concept of medical tourism is not going away, and it might become more of a thing. And Cuba really isn't letting up in their tireless effort to just really help. So if we keep pushing this, I really feel that this is a real way in on Cuban and U.S. relations, and obviously a way to help people that's needed. I don't think anyone else has any questions, and it is now 9 o'clock, so it seems like it's about time to wrap up. I want to thank everyone again for all of your fantastic presentations. These were all just really, really informative. And all of this has been recorded. I will make the recording available, and it is also available on YouTube. It's on the Moratorium Now YouTube channel, so it can be viewed immediately just right there on YouTube. So feel free to check that out as well. All right. Thanks again, everybody. Unless there's any more comments or things to say, I think this pretty much wraps it up. So again, hopefully people can join us on Monday at our Moratorium Now meetings at 7. So find Moratorium Now on Facebook if you want to join that. Okay. Thanks, everybody.
Okay, goodbye.
Have a good night.
Bye all.